Hi, I'm Sarah.
And I'm Supraja, and this is Gin and Tonic.
Welcome back to Intimate Convos with your besties.
Bonjour. There's my orange wine. My only French I've retained is how to say certain words with a French accent.
No, por favor.
Sarah's now fluent in Italian, if everyone was wondering. She's a prodigy.
I can say 10 words in Italian, but I'm on lesson of week 4.
Yeah, you're such a diligent student. It actually is very inspiring. You get something in your head and you just go right at it. I love that about you.
It's because I'm trying to find happiness.
How's it going for you, Boo?
I'm still figuring it out. I'm just kidding. I'm happy.
Me too. I spontaneously cried at work today. It was like having a perfectly pleasant conversation with people that I love and then cried for no reason. So it's one of those days, guys. But we are going to answer questions. Woo! Woo! I actually really love when you say woo in our episodes. It's my favorite.
Did I ever tell you the best compliment a guy ever gave me?
What was it?
That I could be a cartoon voice.
You are a cartoon.
But I was so flattered. I was like, this is better than anything any man has ever said. And somebody's like, what the? I was like, that's really cute. I could be a cartoon voice. That's very novel.
Especially when you talk in that voice where you're joking and you'll say things really fast. It's very Bugs Bunny. You'll be like, oh my God, I'm so sorry. What did you do? I love your cartoon voice. Okay, this is going to be a shorter episode, so you can go back and listen to the last one if you needed more of a fix. But you all wrote in some great questions, and we want to answer them.
Okay.
Shall we do it?
Pregunta número 1.
Shall we go for it?
Yeah. All right, so my OB advised against fertility testing before trying to conceive. I want to know my clock.
Okay, love this question because I feel like there's so much information and all these new resources out there about getting fertility testing. There's all these new companies that have home testing or this kind of startup mentality around initial testing of things.
Yeah.
And I think that in general, more information is better, but talking to someone who can help you interpret that information is the best. So when people talk about fertility testing, I think they mean different things, but the truth is we just don't have great information to predict someone's fertility. We actually don't know how to tell you how long you have to get pregnant by being exposed to sperm. We just don't know that. What we do know is how your body might react if you had to do IVF or things like that. We have better means of predicting how your body might respond to that. So I think that your doctor probably didn't want you to do it because maybe you're in an age range where we have no good ways of predicting it. But for some people, it does make sense, depending on when your family planning goals are. And what your other medical history is, that you might be someone where having some of that information sooner might push your hand in terms of doing something more. So, I don't know, did I answer the question?
Yeah, well, essentially it's I think a lot of these online companies can be empowering, but I think they have to be interpreted with a grain of salt because they can be falsely reassuring. So it's you have to interpret them carefully. And like Super just said, the numbers are actually more helpful in understanding how well you'll respond to IVF treatments if you need it.
Yeah.
That's what they really help with, which is kind of seems ironic. Then why are we getting it for fertility testing?
Yeah.
So
I feel the lab that has gotten the most attention is something called an AMH or an anti-Mullerian hormone. And people use that kind of as a substitute for fertility, but really just like you said, Sarah, all it's really been tested to show is how someone who suffers from infertility reacts to IVF medication. like how well your ovaries can be stimulated in that very specific scenario. And it also has to be interpreted based on your age. Like I had a friend who did one of these modern fertility tests and then was told it was all normal, didn't worry about it for a few years, and then showed me her test results later, and I was like, that wasn't normal. You know, you should have been counseled that you needed to have a conversation with a doctor. So I think they're good in some cases, but definitely helpful to have a doctor relationship that you can review it with, or like hopefully you can have a conversation with the doctor where they understand your goals and you guys can come to a decision about whether or not it's meaningful.
Yeah, I had a friend whose number was low and she had no problem conceiving and has 2 children. So I think it can swing either way of the whatever that pendulum swing.
Sarah and I were both in the OR late today, so we're trying to answer your questions, but also we are tired, and so good luck to you for listening. Okay, Sarah, at my annuals, a listener wrote in, do you judge me for wearing mismatched socks? Oh my god, I would be judged all day, every day of my life. How prepared does my hoo-ha need to be at an annual exam? What do you think, Sarah?
People apologize all the time, like as we're getting to they're like, I'm just so sorry I haven't shaved. I was like, neither have I. Since New Year's. I'm not partnered.
Ever.
I haven't shaved.
I am partnered, and he said he loves me anyway, so there we go.
But people apologize all the time, like, I actually don't care at all.
Also, I cannot remember. Like, I do not register it. Like, I could not tell you what anyone's hoo-ha looked like unless I documented it in a note as, like, an abnormal finding.
Yeah.
Like, do not comment on hair. Like, nothing of the sort.
Yeah, we don't care about grooming status at all. And or people will say, like, oh, you know, I didn't shave my legs or I haven't. Like, I don't pay attention to that stuff at all.
Okay, I'm laughing because we took notes on these questions, and Sarah wrote, maybe don't go 4 to 5 days without showering.
Yeah. Well, people are like, I didn't shower this morning. I was like, that's okay, but like, has it been did you shower yesterday?
Yeah, I mean, if you don't have access to a shower, it's totally fine, but I think the general concept is like, overall good hygiene is good. You just don't need to do it for us.
And we've literally seen everything. There's very little that can surprise us. Like, you know, we've had visits removing foreign bodies from the vagina.
Which is also one of my greatest fears, that I've left in a tampon.
Really?
Yeah. You never have that fear?
No.
Oh, I'm constantly afraid I have something.
I'm just like so psychotic about it.
What do you mean? What does that mean? Like every night you like feel around, make sure nothing's there? You have like a journal, like tampon in, tampon out. Probably Sarah does have a journal. I'm gonna look around later.
I know, probably. Well, and also I have an IUD, so I haven't used a tampon in like 9 years.
True. Yeah, that's true.
But those visits are really fun, actually.
Finding it?
Yeah.
Because you're like, hooray!
The patient's so mortified, but I'm like, this is fun.
Because it's like quick fix.
Yeah,
we're like, oh, we got you.
And we're like, or a patient comes in and like,
it.
My discharge has been smelling abnormal for a week. Something's wrong. Then you put
that is satisfying. Where you're like, this is it.
This
now
is it.
You won't have that problem anymore.
It's because you left your Diva cup in for 3 weeks.
Have you had that?
Yeah, one time.
A Diva cup too? Mm-hmm. I gotta try out this Diva cup stitch.
It hurt.
Oh, you tried it?
Yeah.
What hurt? Like just the inside?
Maybe I need to see a vulvar specialist.
It.
It's because Erica, my cousin, swears by them, and I was like, I even lubed it up.
Oh, you did?
Yeah.
Uber lube and everything?
It's because I have pelvic floor dysfunction.
I know.
I can't relax.
We'll work on it later.
I'm too high strung.
Uber lube. Okay, where are we with our question?
Okay, so yeah, we don't care. Be comfortable. We've had, humans like stool on us, pee on us, bleed on us, retrieve foreign objects.
Once someone peed in my mouth.
Oh God.
Yep, it's happened.
On labor and delivery, not at a GYN visit.
Both.
No.
Well, the labor and delivery was like into my mouth, but otherwise it was on my face.
Really?
Yeah.
Why?
But you know what? I couldn't even tell you who. Like, I don't remember who. I just remember the sweet nurse walking over and like patting my face. Which is how much we associate these things with you specifically, like literally zero. Okay, does it matter if I have my period on my pap, Sarah? Someone wants to know.
In general, no. I will let the patient know there is a possibility that when we do the pap smear, that there will be too much blood obscuring them from seeing the cervical cells. So remember, a pap smear is the cervix at the end of the vagina. So if you think of the vagina like a tunnel, at the very end of the tunnel is like a donut-shaped organ. We use a brush literally to just brush the cervix like this. I'm brushing my forehead. Just to pick up cells. We swirl them in a little jar of fluid, and then the pathologist identifies the cells. But if there's too many red blood cells, then they'll have a harder time. But in all honesty, when somebody's on their period, we just brush the blood away and then do the pap smear. But on occasion, a handful, literally just a handful of times a year, it will say insufficient or obscuring blood. It's very uncommon.
And then you just have to do it again.
Yeah.
And also at the cytology lab where they read it, they have a reagent they put on it to get rid of the blood. So they also try to minimize any effect that has. But I have had friends who told me their doctors automatically canceled their appointments because they were on their periods, which I would never do that.
I wouldn't do that either. No, that's odd. Okay. Am I too old to freeze my eggs? When does the age interval for egg freezing end?
Guys, this is such a sad question.
You guys, did we not answer this on episode 1? Come on.
But it's sad, so we should answer again. One, I have a big problem with using the word old because you're not old. Our bodies just do different things at different times.
No, I'm old.
Sarah's old, but the rest of us are not. I'm just kidding. Sarah's young. Sarah has a young, beautiful body, including your eggs. But yeah, our bodies just do different things at different times. So we also live longer than we used to. We do things at a different time in our lives, and our reproductive systems have not caught up. So I hate the word geriatric, or I refuse to write advanced maternal age, but I'm it's not advanced. It's not advanced. Being 35 is not advanced.
That's
anyway.
I won't write sterilization.
Oh, I hate that too.
What am I, a cow?
Yeah, what?
No,
yeah.
I write permanent contraception. Anyways, I did.
Anyway, so you're not old regardless of what I'm about to say. But I will say that ideally you would do it before 37. And really, if you're thinking far ahead, I'd say 33, 34 is a great time. But before 37, at 37, our fertility really does decline a good bit. After 40, it declines a lot. So many REI doctors, who are the ones who do freeze your eggs, won't do it after 40. There are always exceptions, so it might be worth having a conversation if you're after 40 and that's something that's still of interest to you. That doesn't mean there aren't options. You can, if you really do want to have a baby and be pregnant, you can do donor egg. There are other things that you definitely can do, but I would say
because just
40 is the number to be thinking ahead to.
Remember, as we get older, well, not
Sarah.
Sorry. As we advance in age, I'm just kidding.
As we become geriatric.
As my Botox wears off.
God.
Q3. No,
I need new Botox.
Mine extends to 6-7 months.
Sarah, it's been a year. Sarah,
yeah, it just
Sarah,
wore
show
off.
people how your forehead won't move.
I think it's because
now it's moving, so it wasn't a good thing, but barely.
I think it's because I've been using my robot monotone face with more people.
You have?
Yeah.
Oh, you trained yourself not to use your forehead muscles.
I just give people dead face.
I've been doing that too. This is how I smile now.
I don't even smile. I can't risk the wrinkles. I'm just kidding.
We're kidding.
I'm not kidding.
We're doing well with this aging process. Okay, we're with you.
Oh god, that was very cool.
I kept talking about Botox, and then Adam, which I've had Botox once, no shame though, I honestly really want it again.
I've had it multiple times.
And Adam, poor Adam, who's looks very young for his age. My fiance was should I be getting Botox? I was no, don't let my craziness rub off on you. Your face is perfect. Okay, more questions.
But I just want to say, and the reason we don't recommend doing it too much later in life, like late 30s, is because remember, you have fewer eggs, and the eggs that remain are generally less higher chance of being genetically abnormal. So it's just, you're going to end up doing more cycles. If you're not going to be as successful and retrieve as many good, healthy eggs
later on.
Versus a 33, 34-year-old or somebody younger. Then that's the reason behind it.
And those eggs that are genetically abnormal are less likely to form an embryo implant, so you're just less likely to get pregnant.
Yeah.
Okay. Okay, yes. So these are listeners who clearly listen to our lecture. I called it a lecture.
Kudos to this young person.
Yes.
Young woman who submitted. I'm just kidding.
This person wants to know, what are things that can go wrong with egg freezing? Can I lose my ovaries?
Well, so remember, when you're doing your egg freeze, you're essentially when you're having a regular cycle, not egg freezing, your body is sending hormones to your ovaries to make one super egg that you ovulate. Most people just ovulate.
Super
egg.
If
you can see my hands, I'm like, Okay.
Do you think people just saw my armpit hair?
I don't grow armpit hair. Peruvians don't have armpit hair.
Really? Are Peruvians hairless?
We are like minimal hair.
Oh, Indians are all about it. We love, I don't know why, because it's hot there, but we didn't, not for lack of hair.
I barely shave, anyways. That's true everywhere. Anyways.
Okay, what was the question?
Oh yeah, so
you lose your ovaries?
Every month you really just, super produce one egg. But when you're going through an egg freeze cycle or IVF, they're trying to super produce many eggs at one time. And so your ovaries, grow in size by 10 times. They get to the size of grapefruits. And so the risks in this is you end up producing a lot of fluid in your belly. And your eggs are so big that they could accidentally turn on themselves. That's called ovarian torsion. And so that could be an uncommon risk, but a theoretical risk, and that's a surgical emergency. You would know because you'd be in a lot of pain, you'd be in a lot of discomfort, you'd be crouching over, very uncomfortable. So that is theoretically a risk, and if it did happen, it's a surgical emergency. Other things, during your procedure when they're actually retrieving the eggs, they put a vaginal probe while you're asleep into the vagina, and then the probe has a needle attached to it, a very small needle that punctures the top of the vagina and enters into the abdomen and then punctures the ovary to kind of suck out the eggs. In doing so, there's some bleeding that happens. In general, the bleeding is minimal and you'll feel a little discomfort, but in some cases it can be a lot, and then you can have bleeding in your abdomen, and that might require surgery or a procedure. These are uncommon though.
I'd say all these things are super rare. So
in the past, they would really pump up the hormones, and people would get admitted for being too hyperstimulated.
That just doesn't happen as much.
It's just super uncommon now. There's so much more
careful decision making, better understanding of how much medication everyone needs. We're just better at medicine, basically.
Yeah.
So everything comes with risk, but in general, egg freezing is really safe.
Yeah.
Okay,
so I had no issues conceiving the first time but now can't get pregnant the second time. Why?
So crappy. It's so tough when you're trying to get pregnant and you have trouble, especially when it's unexpected.
Mm-hmm.
We would call that secondary infertility. So, and again, I hate the word infertility.
Really?
I write fertility concerns.
I write difficulty conceiving. I do that too, actually. I write difficulty conceiving.
I just feel it's so cruel.
It's kind of like when people write they failed their glucose test in pregnancy.
Like
they didn't fail. I don't write for
it.
I just say did not pass.
But okay, so we technically call it secondary infertility, although if Sarah and I are your doctor, we'll probably try not to say that word to you. But that's basically when you had one pregnancy where you got pregnant spontaneously, and the second pregnancy you weren't able to for over a year, or in some cases 6 months, depending on the situation. And there are a lot of reasons that can happen, although often we're just not sure. So reasons can be issues with the structures in your body. So scarring in the uterus, scarring on the tubes that don't allow either the egg to get into the uterus via the tube, or don't allow for implantation, don't allow for the sperm to join the egg. So that can be it. Some people experience what we call premature ovarian failure, which basically is kind of like an early menopause. Like your eggs and ovaries just start acting like they're going through menopause in an age period in your 30s instead of in your 40s.
Super uncommon.
Super rare. And then there are genetic abnormalities. So some people have genetic abnormalities in the mom and the dad if it's a cisgendered couple. And the combination of those genes together predisposes them to things like miscarriages. So that's possible too, also really rare. And then some people just have unexplained infertility. In general, about 10 to 20% of people who have infertility have unexplained infertility, which basically means all of your testing is normal. We don't know why. We just have trouble getting pregnant. And in those cases, they have the most success doing IVF. Okay.
And your doctor can do some of this workup for you, but if you're having regular cycles and you're still not able to get pregnant, with regular cycles meaning you're ovulating, your ovulation predictor kits are positive, and all your testing is normal, there's very little your OBGYN is actually going to be able to do for you. So I tell my patients, if this is happening, we can either do your workup at a fertility center, I can do it for you, but
Book it to the fertility center.
It's just there's not anything I can do for you.
And when Sarah says nothing I can do for you, she just means a generalist, like not the world, but just we would refer you to someone who did 3 more years of training than we did in fertility science. Okay, so someone wants to know, Sarah, how long they have to wait after getting their IUD removed to get pregnant?
Nothing.
Get it poppin', boo.
Yeah, because remember, when you have the IUD, the way it works is it's a local effect, meaning it's just really having hormonal effects in your uterus. It's not like the pill or Depo or the implant where it's tricking your brain and affecting all of your hormones. It's really a local effect. And so most people are still ovulating when they're on the IUD, actually. Yeah. So when you remove the IUD, you may have a delay in your period coming back, but it's usually not because you're not ovulating, but it's because the IUD has really thinned out the lining of the uterus, and that's why people don't bleed while they have an IUD. But I've had people get pregnant without even having a period because they're still ovulating.
Yeah. There's no hard and fast guidance about it. I often recommend people wait until 1 period only because we date pregnancies from your last menstrual period. So if you get pregnant before that period, it's hard to know when your pregnancy started, but not dangerous to get pregnant sooner.
Yeah. And some people do stop ovulating when they're on the IUD, usually in the first few years after insertion. But so those people might have a little bit of delay in return of ovulation and fertility, but in general, most people can conceive, the same way as the general population without an IUD does.
Okay, and this leads to another question via listener. Can an IUD affect my fertility? And the answer is no, it does not affect your ability to procreate at all. Get the IUD out, have your babies, get at it.
Yeah.
The only thing I would say is that because a lot of people stop having a menstrual period when they have an IUD, sometimes you're not as aware of natural changes in your cycle. So if you are someone with really irregular bleeding, or if you're just going through other changes, you might not be keyed into that as quickly because the IUD is masking what you would be doing without hormones. But that's still really rare.
And then, do I have to urinate after sex?
Sarah says yes. She says she has to urinate immediately, otherwise she's UTI central. But
9 UTIs in my early 20s.
9? Oh my god, that's so rough, Sarah. Wait, how do you know 9? You counted?
Yeah.
You kept, again, a journal, or what? Sarah's like, today was UTI number 5.
That's probably because my urgent care was like, again! I was like, I just went to bed after. I couldn't get up.
Cartoon voice. Okay, so basically the concern is for having recurrent UTIs, which means you either had 2 UTIs or more in 6 months, or 3 or more in a year. And some people are really prone to this, other people not as much. When you look at big studies, actually peeing after sex was not a consistent thing that stopped UTIs, but some people it matters more than others, and I'd say the risk is low. It's not that hard to pee after sex. So we often encourage it, especially for people who are prone to UTIs, but the evidence is out whether it really makes a difference. Sarah doesn't believe me.
Well, okay, because think about this. When you're being intimate with somebody, all the fluids, you produce lubrication, and that fluid, your vaginal opening is literally right next to your urethral opening.
Okay, Sarah's going to do another study.
Okay.
She's not biased at all in what the results will be. But so far, the studies don't agree.
Well, and then
that matters for everybody.
The anus is really close too, you know? I'm just saying, the holes are close.
Okay, yeah, so this is another thing a lot of people talk about, direction of wiping. Front to back.
Too.
What, you were doing back to front? Were you really? Why? Just like I've like recently messed it up. And I tried to counsel someone to do it back to front, and they were like, wait, you mean front to back? And I was like, yeah, I do mean front.
I don't think I even wipe. I just like blot now. I'm afraid I'll mess it up.
You're afraid that's why you blot?
I blot.
Okay, I support you. Okay, but so front to back is better, but again, the research is out whether or not it really affects your UTI risk. The big controlled studies don't really show that it makes a difference, but no harm in doing it, and it could make a difference for you. Things that do matter, that have been proven. Are you crying?
No, I just... Whatever, evidence-based, whatever.
Is drink lots and lots of water, like 2 to 3 liters of water. Avoid things like spermicide, rely on other methods of birth control. I'd say those are like 2 things that matter. And then if you are someone who repeatedly gets infections, sometimes your doctor might put you on an antibiotic for right after sex. That can help. Or if you're someone after menopause, sometimes things like estrogen cream can matter.
Big fan of that.
Okay, good. Yeah. We're on. Sarah and I are aligned. Okay, Sarah, who needs an anal pap? I actually want to know this because I don't know.
Okay. So anal pap smears are in reference to screening for anal precancer, kind of like cervical. The reason we get pap smears, it's of our cervix. We're screening it for cervical cancer. So there are certain parts of our bodies that we can fortunately screen for cancer, meaning we can do things to detect it early, like breast cancer, colon cancer, cervical cancer. So for things that are caused by HPV or affected by HPV, the cervix, the vagina, the vulva, and the anus, you can sometimes detect those early with certain tests like cervical cancer screening with pap smears. And so if somebody has a history of abnormal pap smears, and there's different degrees, there's low grade abnormalities and high grade abnormalities. If you have a high grade abnormality of the cervix, you should get an anal pap smear. Or if you had a high grade abnormality of the vulva or the vagina, a lot of people, the screening for that is a little bit different. It's mostly, I saw a mole or something abnormal in the vulva, biopsy it. Okay, so it's really only diagnosed in the moment. But if you had high grade of the vulva, of the vagina, or the cervix, you should be doing an anal pap smear. And it's
okay. And we were talking about how often, which there are a billion different societies who have a billion different suggestions, but no one has really agreed upon anything. But probably if you do fall under one of those categories that you mentioned, you should start yearly and then have a discussion with how often.
Yeah, and there's so many different societies, and they're going to finally come up with one standard census. And actually, an anal pap smear is easier than a cervical pap smear.
Because you don't have to have anything stuck in the anus.
Well, a brush.
Except for the brush.
But the brush is different.
Device.
It's a Q-tip. It's not the brush that they use for the cervical pap smear, and you don't have to put an instrument in the anus. It's literally just you moisten a Q-tip, you put it into the anus about 4 to 5 centimeters. It's really not that bad.
I'm just laughing because of your hand gesture.
It's really not that bad. And then you just go, a little into the anus, and then you swirl it out. It's really not that bad.
Swirl it out. Yeah, I agree with you with that. Okay, and then what all do I need swabbed for STDs? You gotta swab every hole you're using. Yep. Mouth, vagina, anus, all of it. Okay? And then there's also blood testing that you can do. So,
but do you swab for all the other holes?
Like I should, but I don't always. But sometimes I do. There's a lot of oral chlamydia, like a lot.
I know.
Yeah, and no one ever swabs for it. So yeah, you should get it all swabbed. If you're, putting things in your mouth, then put this brush in your mouth too.
Well, okay, I gotta go swab myself.
Yeah, you want me to swab you? To be decided. We'll decide later. All right. Those are all the questions. So if anyone has more questions, feel free to DM us on Instagram. We're at Gin and Tonic Podcast, Gin spelled Gyn. You can comment in our YouTube, same name. And that's all. We'll get back at ya.
Thanks for the questions.
Love ya.
Arrivederci. Did you like that?
Then like and subscribe.
Please.